I'm delighted to greet everyone from Brazil. As you all know, Digestive Disease Week is the largest meeting of gastroenterologists and people who do research in gastroenterology, endoscopy, gastrointestinal surgery in the world. We anticipate that there'll be over 16,000 attendees this year, in addition to exhibitors. We have about 5,000 presentations in the form of poster sessions and oral presentations. There are state-of-the-art lectures, clinical symposia, and research topic fora. So there really is something for everybody. There's a lot of exciting news that's coming out of Digestive Disease Week this year, and I thought I'd give you just a sampling of two studies that are going to be presented. One is from Dr. Miriam Voss and colleagues at Emory University in Georgia, and they did a survey of teenagers to determine, based on elevated ALT levels, what the likely prevalence of non-alcoholic fatty liver is. And they came up with a result of about 10%. 10% of teens in the United States are likely to have non-alcoholic fatty liver disease. It turns out that the risk of non-alcoholic fatty liver disease does not correlate with weight per se, but with waist circumference. So that requires further study, but I think this is an interesting finding. And then there's another study by Dr. Stefan Wawryka and colleagues in Zurich, Switzerland, looking at patients with inflammatory bowel disease who have taken flights, comparing those who have not taken flights in an airplane, and finding that the risk of a flare of inflammatory bowel disease is higher after a flight, after air travel. They speculate that this may be due to reduced oxygen tension and therefore reduced oxygen perfusion of tissues, leading to flares of inflammatory bowel disease. So that's another area that's ripe for investigation. So that's a sampling of some of the studies that are being presented this week, and there are many others, and we thank you for your interest in Digestive Disease Week.